Sauvaghn.
I'm Jordan. I'm Nico.
And we are from the Stasis Class Period 4B, and the purpose of this video is to discuss the movements, the 17 movements, the joints involved, and the different muscles, and real-world examples.
So the movement is flexion. Selected joint is the elbow joint. The muscles involved are triceps brachii, brachiolateris, brachialis, biceps brachii, pronator teres, pronator quadratus, and the acroneus. The agonist is the biceps, the antagonist is triceps, and the plane is sagittal. The movement is abduction and adduction. Both joints are ankle joints. In abduction, the muscles involved are peroneus longus, peroneus brevis, flexor digitorum longus, and tibialis anterior. The agonist is soleus, and the antagonist is tibialis anterior. For adduction, it's tibialis posterior, tibialis anterior, flexor hallucis longus, flexor digitorum longus. The agonist is tibialis anterior, and the antagonist is flexor hallucis longus. And the planes are the frontal plane. The movements are ulnar deviation and radial deviation. Both are the radiocarpal joint. In ulnar deviation, it's flexor carpi radialis, flexor carpi ulnaratus, and the poculus longus. The agonist is triceps brachii, and the antagonist is wrist extensor. In radial deviation, it's flexor carpi radialis, extensor carpi radialis longus, and extensor carpi radialis brevis. Agonist is extensor carpi radialis longus, and antagonist is flexor carpi radialis. And both of them are in the frontal plane. The movements in this video are supination and pronation. Radial ulnar joint is for supination. Proximal radial ulnar joint is for pronation. Pronator teres palmaris longus, flexor carpi radialis, flexor carpi ulnaratus, flexor digitorum superficialis is supination. The agonist is supinator. The antagonist is pronator teres. The pronator teres and pronator quadratus are in pronation, and the agonist is pronator teres and antagonist is supinator, and they both are in the transverse plane. So the movement is plantar flexion for this one. The ankle joint is our selected joint. The gastrocnemius, soleus peroneus longus, peroneus brevis, tibialis posterior, flexor hallucis longus, and flexor digitorum longus are the muscles involved. The agonist is tibialis anterior, and the antagonist is gastrocnemius, and this takes place in the sagittal plane.
Dorsiflexion, and the joint involved is the ankle joint. The muscles are tibialis posterior, flexor digitorum longus, gastrocnemius, and soleus. The agonist is tibialis anterior, the antagonist is plantar flexors, and the plane movement is sagittal plane.
The movement here would be circumduction. The joint would be the shoulder joint. The muscles involved would be the teres minor, the supraspinatus, the infraspinatus, and the supracapularis. The agonist would be the latimus dorsi, and the antagonist would be the deltoid and is multiplanar. Here would be lateral rotation, and is the hip joint, and the muscles involved would be the piriformis, gemellus, superior obturator, internus gemellus, inferior quadratus, femoris, and the obstructor externus. Agonist would be hamstring, and antagonist would be quadriceps, and it is in the transverse plane. In the medial rotation, it uses the hip joint, and muscles involved would be the subparietalus pectoralis, major latimus dorsi, teres major, and the anterior deltoid. Agonist would be the pectineus, and antagonist would be the gluteus minimus, and it would be in the transverse plane. Movement involved would be protraction. It would be the shoulder joint, and the muscles involved would be the supraspinatus, infraspinatus, teres minor, and the supracapularis. Agonist would be deltoid, antagonist would be the latimus dorsi, and it is in the transverse plane. The movement here would be hyperextension. The joint would be the shoulder joint. The muscles involved would be the deltoid, biceps, triceps, and the latimus dorsi. The agonist would be the deltoid, antagonist would be the latimus dorsi, and is found in the sagittal plane. The movement is extension. The joint is elbow, and the muscles are latimus dorsi, teres major and minor, and posterior deltoid muscle. The agonist is biceps, and antagonist is triceps, and this is found in the sagittal plane.
The muscle movements in this video are inversion and eversion. The joint for inversion is tarsal joint. The muscles involved is tibialis anterior and tibialis posterior. The agonist is flexor digitorum longus. The antagonist is extensor hallucis longus. The plane is frontal plane. In eversion, the joint is plane joint. The muscles involved are peroneus longus, peroneus brevis, and peroneus teres. The agonist is peroneus longus, and the antagonist is peroneus brevis. This plane is the frontal plane.